Attention! There are medical tests that may seem harmless but can cause serious problems. Many of them are requested unnecessarily, leading to false diagnoses, needless worry, the use of medications with side effects, and even significant health risks. That is why it is essential to know 7 very common tests that, when ordered without proper criteria, create more confusion than help. The first of these is the blood insulin test. Many people believe it is used to evaluate insulin resistance or even to predict diabetes, but in reality, there is no solid scientific evidence to justify its routine use. The diagnosis of prediabetes or diabetes is made with other tests, such as fasting blood glucose, glycated hemoglobin, HbA1c, and the oral glucose tolerance test. The insulin test is not part of this diagnostic process. Furthermore, insulin levels fluctuate unpredictably. They can change every hour depending on momentary factors, producing falsely high or low results. So, when is this test truly useful? In very specific cases, such as when there is suspicion of an insulinoma, a rare tumor that produces insulin. In these situations, the patient usually presents with episodes of hypoglycemia, and in that context, measuring insulin does make sense, always in combination with other tests. Outside of this, requesting insulin as a routine test only causes confusion. Very often, the results lead doctors and patients to believe there is a non-existent risk, creating anxiety, additional tests, and even inappropriate treatments. The second test that deserves attention is the carcinoembryonic antigen, known as CEA. This tumor marker is often ordered to assess the risk of colorectal cancer, but it should not be requested as a routine screening tool. The reason is simple. It produces many false positives. A simple cold, an intestinal inflammation, or even smoking can raise its levels. The problem is that when people see an elevated marker, many panic, believing they have cancer, when in fact there is no evidence of that. To make matters worse, the opposite can also happen. Many colorectal tumors do not produce this marker. This means that even if the disease is present, the test may come back normal, creating a false sense of security and delaying the correct diagnosis. The truly effective method for colorectal cancer screening is colonoscopy, recommended from the age of 45 for people without a family history, and earlier for those with risk factors. This exam allows doctors to identify and remove polyps before they turn into cancer, something that a tumor marker could never do. The third test that can be dangerous when ordered without clear criteria is the thyroid antibody test, known as anti-TPO. It is often requested excessively, but it is positive in up to 20% of healthy individuals, without indicating disease. Many people receive this altered result, believe they have a serious problem, and end up undergoing batteries of unnecessary exams. This marker should only be requested when there is suspicion of Hashimoto's thyroiditis or another autoimmune thyroid disease, and always in combination with tests such as TSH and free T4. Otherwise, it only generates confusion, worry, and even the risk of unnecessary treatments. The fourth test that can mislead many people is the food allergy IgG test. This exam has become popular, but it has no reliable scientific basis. Renowned medical societies have already stated that it is not valid as a diagnostic tool. The problem is that, when performed, it often comes back with several positive results, suggesting allergies to foods that the person normally consumes without any issues. As a result, many patients unnecessarily eliminate healthy foods from their diets, believing they are protecting themselves. This can lead to nutritional deficiencies and unjustified restrictions that harm quality of life. The true diagnosis of food allergies should be made with other tests, such as the skin prick test or specific IgG blood tests, both of which have proven scientific validity. Food IgG, on the other hand, only generates confusion, fear, and unfounded changes in habits. The fifth test that requires great caution is the cortisol test. This hormone plays an important role in the body, but the basal cortisol test is not reliable for assessing excess levels. It is often ordered to investigate stress or fatigue, but the results can be misleading. The correct diagnosis of cortisol excess, such as in Cushing's syndrome, requires specific tests like the dexamethasone suppression test, in which the patient takes medication before the blood draw to evaluate whether the body continues producing the hormone in excess. Another problem is the salivary cortisol test, which has also gained popularity but rarely has validity as a screening tool. Cortisol naturally fluctuates throughout the day. It starts high in the morning and decreases by nighttime. When someone takes the test at different times, they may be alarmed by low values that are, in fact, completely normal. This confusion has led to invented diagnoses, such as the so-called adrenal fatigue, which does not exist in evidence-based medicine. The result is that many people end up using corticosteroids unnecessarily, running the risk of diabetes, hypertension, osteoporosis, and even obesity. The sixth test that should not be performed routinely is the prolactin test. This hormone can vary for numerous simple reasons: tight clothing, physical stimulation of the nipples, exercise, or even the use of certain medications. In many cases, an altered result does not indicate any problem but simply a physiological response of the body. When requested without clear justification, the test creates panic, leads to unnecessary investigations, and raises suspicions of non-existent tumors. This test should only be ordered in specific situations, such as infertility, menstrual cycle irregularities, low testosterone in men, or suspicion of a prolactin-producing tumor. Outside of these contexts, the risk is merely generating fear and unnecessary interventions. Finally, we come to the seventh test on the list: reverse T3. This exam has been gaining ground in laboratories and doctors' offices, but it should not be requested as a routine test. Many people believe it reveals hidden flaws in thyroid function, even when the main tests, TSH and free T4, are normal. This interpretation, however, is mistaken. Reverse T3 is only useful in very specific cases, such as in hospitalized patients with severe illnesses where there is suspicion of the so-called euthyroid sick syndrome. Outside of that context, the test adds no value. The problem is that many people receive an altered reverse T3 result despite having absolutely normal thyroid function, and they end up taking thyroid hormones unnecessarily. This can be extremely dangerous, as the inappropriate use of these medications can atrophy the thyroid itself, trigger arrhythmias, increase the risk of osteoporosis, and compromise long-term health. The central point of this entire discussion is that medical tests must be requested with clear criteria, based on symptoms, history, and scientific evidence. Ordering tests without necessity is not a sign of extra care but rather of recklessness. Very often, this practice generates anxiety, false diagnoses, and treatments that cause more harm than good. It is important to understand that health is not maintained through an excess of poorly indicated exams, but through balanced habits, responsible medical follow-up, and screenings that truly have scientific validation. Colonoscopies at the appropriate age, blood glucose and blood pressure tests, cholesterol monitoring, and other well-established protocols are the ones that actually save lives. That is why it is essential to be wary of fads and requests for tests that are not part of recognized medical guidelines. Before accepting any exam, it is worth asking, is there evidence that this test will help me? Is it being requested for a clear reason or merely out of habit? The answer to these questions can prevent false diagnoses, unnecessary medications, and years of needless worry. Taking care of your health is much more than collecting stacks of lab reports. It is about prevention, science, balance, and intelligent decisions. Avoiding baseless tests is also a way of protecting yourself. After all, less can truly mean more when it comes to health.